Hello, I'm ready to teach. I hope you're ready to listen. Today I'm going to talk about delegation. A lot of people get this confused and mixed up in their heads, and then when they get the question, they're so mixed up they don't know what to do. So I'm hopefully going to help clear some of that confusion up today. I've even got a couple questions at the end to see how well you learn. So the first thing we're going to do is we're going to change the screen here. Okay, so delegation. Delegation is the act of passing the performance of selected nursing tasks to a situation to an individual. That individual must be competent and has the authority to perform the task being assigned. Now that in and of itself should tell you how important it is that you get this right. So is the person I'm delegating to, are they able to, have they been taught how to do that task? Can they do it in that situation? Okay. Next, the Nurse Practice Act of the state is consulted as who can perform what task. So now there are 50 states in the United States, and all 50 states kind of have varying things as to what people can do. Now, what you're going to get on the NCLEX is a generalized question that all of them agree on. They're not going to give you specific for Indiana or specific to Alaska. It's going to be generalized so that you're going to know whether or not they can do it or not. Even with delegating the task, the nurse who delegates, they are still ultimately responsible for the task, and they must follow up to ensure that it's been done, okay, and done correctly. That's part of that supervising that we all know and hate. And we don't like it when they do it to us. And I'll tell you, when you have to do it on somebody else, it doesn't feel good either. But it's part of being the RN. Okay, so 5 rights of delegation. First, right task. Am I giving them the task that's right for them? Right circumstance. Is it the right time for them to be doing it? An example of this would be a unlicensed assistive personnel going in to take vitals on a fresh post-op. No, they can't do it in that circumstance because we cannot predict the outcome, okay? So understand it has to have the right circumstance. Another example of that would be feeding a patient who's at risk for aspiration. An unlicensed assistive personnel can't do that, okay? Right person. Is it the right person? Can that person do that? Right direction and communication. Have I told them what they need to know and when to report back to me and what to report back to me? And then the last thing is right supervision. Have I gone and checked to make sure that they did it, and did they do it properly? 5 rights of delegation. So examples of who can do what task. Let's start with the bottom of the barrel. And they may be the bottom of the barrel, but they are your right hand. Do not be mean to these people. The unlicensed assistant personnel. They can bathe, they can feed, as long as the client is not at risk for aspiration. They can help with grooming, they can do I&O, they can do dressing, getting them dressed in clothes. They can do a percentage of meal eaten. They can do vitals as long as that patient is stable. If you cannot predict the outcome of those vitals, don't be assigning it to them. And then last, they can ambulate. But again, the client has to be stable. You ought to be catching on. Is the client stable? Can they do this? Then examples of who can do what task for an LPN. They can give oral meds, they can give subcutaneous injections, they can give IM injections, they can give pain medicine that is scheduled. But if it is something like PRN, a new assessment is needed to be done prior and then even after. So that requires the RN. And then they can do NGs, they can do G-tube and NG feedings, they can do a urinary catheter, and they can do wound care of chronic wounds. Key term here for LPNs is, again, they have to be stable or they can be a chronic condition. So when you're reading questions, and a lot of the students that come in the office and the students I see online all seem to read into what the question says. And this is where you can't read in. You just got to go on what they give you. If it says they are 1 hour post-op and you're assigning it to an LPN or a UAP, understand you can't predict the outcome. So therefore, it's not safe to give it to them, even if they could normally do it. And for an LPN, that would be an NG tube after surgery of an abdominal surgery, and they have the NG, and the NG is not working. That requires the RN, not the LPN. A urinary catheter, they can put a urinary catheter in, but if there's a problem with it after surgery that requires an assessment, then they can't. All right, so next is the registered nurse. The registered nurse can do oral, intramuscular, sub-Q, IV push, and IV. They can do teaching, assessment. They can do nasogastric tubes. They can do urinary catheters, wound care of acute and chronic. They can do blood and blood products. Also, they can do any task assigned that's been listed elsewhere. So when we come to the registered nurse, there's always that question that has the orientated RN. You know, she's in orientation. What can she do? You need to understand that she kind of steps into that licensed practical nurse situation, and she's doing that. Okay. And then just understand that they don't do all the things a regular registered nurse does until they've totally gotten it down. Okay, so first question. The RN is making an assignment for the day. Which of the following would the RN safely assign the unlicensed assistive personnel? 1, assist an old CVA with lunch. 2, assist a 1 hour post-op client to the bathroom. 3, turn and reposition a myasthenia gravis client. 4, assist taking vitals on a chronic bronchitis client. 5, assisting getting vitals on a client who just returned from the recovery room. Now, the question is asking, who can I safely assign to an unlicensed personnel? So I need to pay attention and not read into any of the questions. Number 1 answer says assist an old CVA with lunch. It doesn't say it's a new CVA. So old CVA, and it doesn't give me any history that the patient has trouble swallowing. So on that basis, yes, that one could be done by unlicensed assistive personnel. Assist a 1 hour post-op client to the bathroom. No, I can't predict what that patient's going to do in that trip to the bathroom. Are they going to pass out? Are they going to become dizzy and fall and hit the floor? What's going to happen? I can't predict. So no. Turn and reposition a myasthenia gravis client. Does not say that this client is in exacerbation. Does not say that she's having any issues that require an RN or an LPN. So yes, she could do that. Assist in vitals, taking vitals on a chronic bronchitis client. Yes, that's a chronic condition. She can do that. Assist with getting vitals on a client who is just returned from the recovery room. No, again, I can't predict the outcome. All right, so we've gotten through assistive personnel. So now let's do the RN delegating to an LPN. The RN has several tasks to do in the next few minutes. An NG needs put down on a client with a bowel obstruction. An IV push needs given to the heart failure client. 2 units of blood needs given to the client in 202. And catheterize a client who's experiencing urinary retention. It's asking me to select the actions an LPN could be delegated safely. And it's to select all that apply. Now, I want you to notice there's only 4 answers. If I don't read the question to the end and I don't see select all that apply, I would do the assume thing and assume that there's only one answer, when in all probability, there's more than one because it's a select all that apply. So first answer is an NG needs put down on a client with a bowel obstruction. Is there anything there that tells me the client is unstable that would require RN assessment? I'm going to leave this one for you to think about. An IV push needs given to the heart failure client. That is definitely not on the list for an LPN to be able to do. So out the door with that one. 2 units of blood needs given to the client in 202. No, the LPN can assist, but she can't give the 2 units of blood. Catheterize a client who's experiencing urinary retention. Yes, she could do that. Now let's go back up to the bowel obstruction. Does it say that the bowel obstruction is acute? Does it say that the patient's vital signs are declining? No, it just says that they need an NG put down. So at this point, reading what's there, not putting anything into it, I would say that she could do number 1 and number 4, but not 2 and 3. I hope this has helped you in some way. Delegation is something that most students take time to learn. So if you have any questions, you always can reach me at one-on-one@nclextutoring.com. Okay, talk at you later. Bye-bye.